Thank you so much for joining us on BW Healthcare World. Dr. Kochhar, you spoke about कि जो इधर बैठे हैं उनको लोग बुरा बोलते हैं और जिनको देखा नहीं उनको खुदा मानते हैं. अभी मैंने आपको सुना.
नहीं, ऐसा नहीं है. मैंने बोला जो सामने है उसे बुरा कहते हैं, जो उसको देखा ही नहीं वो खुदा हो गए. तो दिस वाज इन कंपैरिजन टू standard which has been released, which is ISO 7101. So I have no disrespect for ISO, I have no disrespect for the healthcare management standard also, but probably it's not a right thing at this stage. We are already an advanced economy. We are speaking of being a Vishwa Guru.
Correct.
We are speaking of a Atmanirbhar Bharat. So 18 साल से for past 18 years we have set ourselves standards in the form of NABH standards. And these standards are comparable to the best in the world.
Right.
And today 20,000 hospitals are already following it.
Absolutely.
And even we have government standards in the form of NCOAS, we have IPHS standards, so these by NHSRCO, Ministry of Health and Family Welfare. So no matter if they are not NABH standard, but India follows advanced SOP standardization. That is the message. There are 40,000 hospitals. So these very primitive standards are not for our country. They are for countries which do not have their standards. So that is what I meant.
And Dr. Kochhar, one of the very interesting things is that what we are doing today, first is we have to accept that we are an advanced country, especially when it comes to healthcare.
Yes.
Instead of following the standards, we should be the ones who have to create the standards which other countries have to follow.
Absolutely.
What do you think is the role of NABH in changing the mindset of the hospital leaders? And and how is NABH triggering this change in how these people think and how they should be thinking as leaders and not the followers?
So, Mr. Nurullah, I think that's a fantastic question. One, it's a great question. Second point, already most of the CEOs and healthcare leaders are aligned with us. See, first of all, if any hospital partners with NABH, it can be because of a variety of reasons. Because of the prestige, because of the incentive which the government gives them. There is no question about it. There are also, black sheep in the system which will try to get a certificate by hook or crook or whatever. But that is part of the normal, right? But most of the existing leaders believe, because who have been through multiple cycles, their own processes become streamlined, their hospital outcomes become better, their staff is happier, their value increases. As you just heard in the panel discussion, some of the leaders outlined that it is a matter of prestige, pride and overall perception about their facility. So it is a good thing for their hospital that NABH which has brought them. And what to do for the mindset of others? I agree, it's a job for us to reach out to them, convince them by data-based decision making. We have to give them back the data on a national level about where they are, how NABH actually makes a difference. Combined with reaching out to the common man and convincing them that accredited facilities are much better. Now that the government has started to push the public health facilitated also, public funded facility like AIIMS also are partnering with us. There is no reason we can create a mass awareness about patients demanding accreditation. That is going.
And Dr. Kochhar, one of the things is that larger hospitals understand the value, and it's easier to have them work with NABH. Is there some kind of a success story that we can share which can be useful for a smaller hospital, somebody with fewer beds, to understand why they should go in for NABH accreditation?
Certainly. We have more than 12,500 Chota hospitals partnering with us. Every month we are adding 250 new hospitals. So the question being that these hospitals are convinced over time, and we can take multiple use case studies from them, showcase them and take it back to the public about how. I think that's a very good suggestion. We have done it on a smaller scale, but now we need to roll it out at a much larger scale. Thank you for the suggestion.
And Dr. Kochhar, before I let you go, how has your experience been at CAHOCON? What do you think, events such as CAHOCON can actually help in bringing that message forward and having the whole ecosystem understand what you are doing?
So CAHOCON is a very important flagship event of the quality fraternity. This was the 8th edition. I've been regular partner. In fact, QCI and NABH and NABL have been regular partner at CAHOCON, and we wish them all the success. This is one platform where all stakeholders, nursing officers, pharmacists, the entire quality community comes together in a big way to learn from each other, to engage with each other. I think it's a fantastic conference. I would like to compliment the entire leadership, Dr. Vijay Agarwal sir, Dr. Lalu, and all those tireless workers who have worked hard to create this conference. I wish them all the best and more power to them for all future CAHOCONs. Thank you.
Thank you so much, Dr. Atul.